Hello, this is Will for Better You. When we have chemotherapy or we have a transplant, especially a kidney transplant, what they're doing is they're putting a kidney that usually sits in your back into your abdominal. And the reason why they want to put it there is because it's easier access in case they need to do a biopsy or they need to do a transplant. So instead of cutting through all your tissue from your back, what they used to doing it before, now I just have a scar that starts here, toward from the groin, and it comes up. And more like if you see an I Better You logo on the bottom of it. So I have two, one kidney on each side. You end up getting an object that usually sits in the back and it sits towards the front. And that, along with cutting through the muscle fibers and along with putting the organ in there and giving you prednisone, we tend to have a fuller belly. But let me tell you, I have two kidneys inside of me now, and I'm still bringing my abdominal region out. Well, even with my first kidney, I could sport a six-pack. When we think abs, you think you want to work the abs and work the abs and work the abs. Most of the times, I do not work the abs of my clients. What happens is when you're using machines as such, your core is always engaged. And I always say, as others do, abs are made in the kitchen, which means it's what you eat. You can't just crunch away. However, you do want to make your abs stronger because you have to get the signal back in your transverse muscles of the abdomen that lie deep within. Many will do planks to do this, but if you want to feel your transverse muscles, what you should do is here's the waistline. Put your fingers right underneath there. Now, for those who had a kidney transplant, it's right towards the bottom of the scar. Then what you want to do is blow out. Keep blowing and blowing and blowing, and you'll feel a tightening and cramping. These are those muscles. The reasons why you want to keep those muscles strong is because if they are weak and lackadaisical, your back will actually take most of the stress and you'll have back problems. So if you keep this tight, you'll notice that your back pains will go away. Here's some of the exercises that you can do. Of course, you can do a plank. A plank would be, you get on all fours and on your elbows and you straighten yourself this way. And you blow your air out, as I told you before. And you keep blowing and blowing and blowing and trying to hold that. You can go 5 seconds, 10 seconds, and do that 3 times, 4 times every other day, every day. Before you go to bed, just make it a habit. You can actually strengthen those muscles. But yet there's the rectus abdominis, which is the largest part. So we're going to show you a couple of machines that you can do instead of trying to do crunches on the floor. For those who don't have access to machines, what you can do is lie on your bed, bend your knees, and then put your hands across here, tuck your chin, blow out and crunch. And what you're trying to do is blow out to make that muscle cramp as you did with the transverse muscles. Here's another machine you can stand here. This is an ab coaster. What you do is you put your knees on here and let your feet lock. Your elbows go here. Now in commercials, you would see these, for old enough to remember, people doing this and they're smiling. If they're smiling, they're not working. End up putting pressure on your elbows, you're straight up, and what you want to do is blow your air out and contract. Fight it coming down. And contract, fight it coming down. You don't want to do this, because if you do this, you're not doing anything. If you want to go laterally, you can do it this way, crunch the same way, or you can turn the crunch this way. That will work for you. Come with me, I'll show you another way you can do it. Many machines in here, and a lot of them, believe it or not, you may not have an ab machine, and here's something you can use. This is a leg extension, and the job of the leg extension is to have your legs come up here to work your quads. You can also use it this way, thinking knee up. Knee up. And if you bring your knees up, thinking up, you can work the lower part of your abs. For women, that little pooch at the bottom, you can get that. So it's not throwing your knees up, it's just lift your knees, lift your knees, lift your knees. Look how much weight I have on there. One plate, lift. It's not a throw, It's a blowout, squeeze it and control it coming down. What do I mean control it coming down? It's not lift the legs and let the legs drop. It's to crunch the abs and let the weight pull the ab across. The same way if you use a bicep, you extend it, you curl it. Follow me, there's so much more to do. This is a glute ham developer. Some people call it a Roman chair. For those who are in shape to do this, very simple. We actually put our feet in and we're sitting back onto the machine. And once your feet are locked in, you can do a crunch. And your crunch will be, you come here, you crunch up. Notice I don't go all the way back and throw myself up. Sit here, crunch up. I always say, look between the crotch area and that would bring your ab into play. Here's another right behind you. This is a cable crossover. What we have is a handle here. You can come down on your knees, take your hands, put them beside your temple. And what you want to do is bring your elbows to the center of your thigh. So you don't want to pull it. What you want to do is lock in here, inhale, blow out, and crunch. Blow out and crunch. This will actually help work the abs too. But wait, there's more. You can also take a regular bench. You can turn lengthways or you can turn sideways. I prefer you turn lengthways. That way, if you do fall back, you have something to fall on. You actually get yourself in a tuck position. Remember, if your lower body moves, that works the lower part of your abs. If your upper body moves, it works the upper. Here you can get a 2-for-1. This is called a tuck. See what I'm doing? I'm crunching, making the navel be the center part. But wait, there's more. We also have ab machines over here where you can actually do a hanging. We have ab machines here where you can actually do a hanging leg raise, where you're hanging and you're just bringing your knees up. And sometimes, stay right there, sometimes we use straps, and straps usually will hook over the machine. You can use over a cable crossover bar. And what happens is when the strap is hooked like that, you stand on the apparatus, you put your arms through, and it will actually keep you hanging up. But for those of us who are older and having problems, these things we don't want to do because we don't want to put ourselves in a situation where we can hurt ourselves. But wait, there's more. This is an oldie but goodie. This is the Nautilus V-Tuck. What we do is we lock our feet in. Remember, you don't need a lot of weight. Most of the time, take the peg and throw it out, because if you do a lot of weight, it's not going to actually make you drop your abs. What it's going to do is to give you a bulk, and it really is not going to help you get that tone low. You're grabbing the handles here, and you'll see people fold. This is what you don't want to do. Everything is about control. So what I'm trying to do here is I'm trying to lift my knees up, and I'm not pulling with this. What I'm doing is crunching, as we did on the seated tuck. Blow out, but watch this. When I come back, I let the abs pull. You know, you don't hear the plank. I crunch, pull, crunch, pull. Not, it doesn't do anything. It's not how many reps you do, it's the quality. But wait, there's one more I want to show you. This is a pre-core, and what this is going to do is work the lower part of the ab. Women love this part because you don't want to have the pooch right down here. So this is going to help. By placing your hands on this, what you want to do is take your knees and go up. If you notice, the machine supports me back here, but I don't want to sit here. I want to imagine this is not behind me. So I just think knees up. Am I going high? No, because when I contract my abs, they stop here. You find someone who's going like this, they're not working their abs, they're just swinging. Those are a few exercises you can do for abs. Can you do them every day? You could. Can you do them every other day? If you ask me, once a week would be great. Take about 10, 15 minutes. Remember, Rome was not built in a day. That, along with your other exercise and your eating, you can actually get past all the chemo and the drugs and the prednisone that's in your body and build a quality physique. Because even though these drugs, sometimes they say can be detrimental, they actually can help, especially with prednisone, with the inflammation that's been shown to do that. So if you do that, eat well, and remember, Rome was not built in a day. You can build a great core, you can be stronger, and then the body will follow long suit with your training and how you eat. Remember, stay consistent, 3 times a week training, and you will get there just like we have. Any other questions? Feel free to ask.
We are the people that refuse to be feeble. I said, yeah, we are the people that refuse to be feeble. I said, yeah, we are the people that refuse to be feeble. I said, yeah, we are the people that refuse to be feeble.